All right, step one, looking at the long head of the bicep tendon. And for each of these, as we go through the exam, I'm going to show you where I'm positioning the probe on the patient. So in this case, I have the probe positioned transversely across the upper arm, right at the shoulder. And after you do this a few times, you're really not going to have to hunt around for it. You'll know exactly where to put the probe. But this is our window to look at the long head of the bicep tendon. So put the probe on there. Now you're going to see the long head of the bicep tendon in its short axis. So here's the long head of the bicep tendon. It sits in this little bicipital groove between the lesser and greater tuberosities. Over the top of it, you see the mass of the deltoid muscle. And there was a question that showed up on one of the exams. What is the dark structure over the proximal shoulder? And it's the deltoid muscle. It's pretty much anterior, lateral, and posterior as you're at the proximal shoulder. Coming off the lesser tuberosity, you can see a little bit of the subscapularis as it's detaching on there. So for each of these windows, they're always going to be done in the same way. So what you're going to want to do is be able to just look at this image with no labels on it, and you should be able to tell exactly what you're looking at. So when I see this image, if someone just showed me this image, there's no labels anywhere, I would know this is the long head of the bicep tendon. This is your bicipital groove. This is the medial side. This is the lateral side, just based on what you're looking at and that you've seen these images before. I wouldn't expect that you're going to, if they're going to want you to look at specific structures and identify them, they're going to put it in that anatomic window that I'm teaching you here. All right, so from there, what I do is I go down all the way to the myotendinous junction of the long head of the bicep. So as I continue down the arm, we started up here looking at this, the model now. As you drag the probe down, you're going to keep your bicep tendon in your field of view. And then when you see this tendon coming across, that's the myotendinous junction of the long head of the bicep. So this tendon coming across here is your pectoralis major tendon. And then directly below it, this is the myotendinous junction of the long head of the bicep. That's where it starts. So if they ask you a question, just you guys, if you've taken the abdomen exam, remember the questions on there where they wanted you to know the layers, the structures you go through from superficial to deep. Same thing here. So if they asked you what you would hit as you go from superficial to deep, you're going to hit the dermis, you're going to hit the deltoid muscle, you're going to hit the pectoralis major tendon, and then you're going to hit the bicep tendon. So bicep tendon is deep to the pec major tendon at this level. And then over here, you have your pec major muscle on above and below this tendon coming across. So when I'm doing the bicep tendon, always go down until you see this tendon of the pec major at its insertion on this lateral lip of the bicipital groove.